So let me start by saying this clearly. Black men, we are just not at risk when it comes to prostate cancer. We are at a higher risk, earlier and often with more aggressive disease. And yet many are still being told, let's wait. You're fine. We'll monitor it. This episode is about why that mindset can be dangerous and what you need to say when your health is on the line.
Welcome to the walkthrough.
Before I go any further, if you've ever felt dismissed, ignored, or unsure what to say in a doctor's office, do me a favor and download my patient protection blueprint in the link below. It gives you the exact words to use when a doctor brushes off your concerns. It tells you what you need to ask for testing, and you're not being taken seriously. Because in moments like this, what you say can change what happens next. So let's talk about what's not being said enough. We as Black men are likely to develop prostate cancer more than any other race, more likely to develop it at a younger age, and more likely to die from it. This isn't about fear, it's about awareness and timing. And here's the real issue. By the time symptoms show up, the cancer may already be advanced. Treatment may have to become more aggressive, and outcomes become less predictable. That's why early advocacy isn't optional, it's critical, it's crucial. So, this is where things get uncomfortable, but it's necessary to hear. There are real gaps in how care is delivered. Symptoms get minimized, screening gets delayed, and concerns aren't fully explored. You might hear, you're too young for that, or let's just keep an eye on it. But here's the truth. For us Black men, waiting can come at a higher cost. And if no one tells you to push back, you may not even realize you should. In 2025, I was diagnosed with prostate cancer. I am in it just like you are. My internal medicine doctor noticed my PSA levels were higher than usual. It was discovered in my quarterly A1C testing that I take as a person with diabetes and kidney disease. She was on it immediately and referred me to my urologist for further testing. Now, she's a great doctor. The issue I had, though, was the lack of urgency received from the urologist group. I was one of many people, a matrix of men and women who are anxious about their conditions, but to them, I was basically like a customer in a New York deli shop. Take a number and wait. I had to wait at least 6 months for further testing, which included another PSA test and an MRI. Then I had to wait another 5 months to finally have my biopsy performed in January of 2025, and that's when cancer was discovered in my prostate. Now, understand this. I'm very involved in my care, and 2 to 3 times a month, I'm sending messages through my chart to my urologist to inquire about alternative forms of treatment. And I'm also advocating for non conventional treatments by holistic practitioners who have assisted others with prostate cancer. I have to be the one who takes the wheel when it comes to this journey with cancer. I refuse to allow others to have my power. Now, I want to shift this discussion to you. This is where everything changes now. You take control. Here are some real things or real scripts you can use immediately. If testing is delayed, ask your doctor this. Given my risk factors, I'd like to move forward with PSA testing now. If your concerns are being dismissed, say this. I understand your perspective, but I feel more comfortable ruling this out now. And if no referral is offered, say this. I'd like a referral to a specialist for a second opinion. And if they suggest waiting, ask them, can you explain the risk of waiting versus testing now? Pause there. Now, here's the thing. You don't need to be aggressive, but you must be assertive. You need to be clear, direct, and persistent. If you're listening to this and thinking, I wouldn't know what to say in that moment, that's exactly why I created the Patient Protection Blueprint. The Patient Protection Blueprint walks you through what to say, when to say it, and how to push back without feeling uncomfortable. Don't wait until you're in the room trying to figure it out. Now, as I said earlier, you must be assertive. Here are signs you need to advocate harder or get another opinion. Your concerns are brushed off quickly, or there's no clear follow up plan, or family history isn't discussed, or you feel rushed or unheard, or they tell you they will monitor your situation with no concrete plan. Listen, this part matters. If you feel like something is off, don't ignore that feeling. Too many people second guess themselves in medical settings, and that cannot be something you do because your life is on the line. So let's make this practical, okay? Here's what you can do starting now. Ask your doctor about a baseline PSA testing earlier. Know your family history. Request clarity, not assumptions. And don't hesitate to get a second opinion. And most importantly, bring someone with you to your appointments like your spouse. And most importantly, don't wait for permission to take your health seriously. You are your best advocate. And this isn't about fear. This is about being aware. This is about timing. And this is about self advocacy. Because the truth is, the system doesn't always catch everything early. Doctors don't always see the full picture. And in those moments, your voice matters more than you think. If you take one step after this episode, let it be this: download the Patient Protection Blueprint, have it ready, know what to say, walk into every appointment prepared, because when it comes to your health, silence can cost you, but the right words can protect you. If this episode has been a blessing to you, if it has helped you in any way, do me a favor, hit the like button, subscribe to our channel, and follow us as we continue down this path of self-advocacy. And I'm going to spend some deeper insights and some more time into prostate cancer, especially among us Black men. So again, I want you to download the Patient Protection Blueprint. I want you to go and send this to someone else. If you're not a person who's suffering from prostate cancer, you know someone who is. Send it to them. Help them along this journey. And most importantly, we're in this together. So we're going to ride this out. And if any of you want to share what you've dealt with as a person or a man of color, or even if you're not a man of color, but you have prostate cancer, if you have anything you want to share, we could build a community, put it in the comment, and we'll help each other out. Maybe I don't have all the answers, but someone in this community that's listening to this episode may have an answer for you. Until then, blessings.